The fate of Obamacare in jeopardy. President Obama and Vice President-elect Pence both heading to Capitol Hill today, bringing their agendas on the legislation directly to lawmakers. President Obama will fight to defend the Affordable Care Act, while Pence will push to repeal and replace it. This as Donald Trump slams Obamacare on Twitter, saying people must remember that Obamacare just doesn't work, and it is not affordable. 116% increases, parenthesis, Arizona. Bill Clinton called it crazy. Joining me now is former Health and Human Services Secretary under President Obama, Kathleen Sebelius. Secretary, it's great of you to be here. The Republicans, include Mike Pence, is also talking about this. The Republicans, Mitch McConnell today set to open debate on a measure that will lead to the repeal and ultimate replacement of Obamacare. Should the Democrats get on board with the Republicans to help design something that works for all Americans?
Well, Dagan, good morning. I think it's so important when 20 million Americans' health care is on the line. These are real people across the United States who finally have affordable, available health care. Replacement should only happen when we know what is going to take its place. There's been this empty promise for really almost the last 7 years that Republicans have a plan, that Republicans want to make sure Americans have affordable health coverage, and yet there is no plan. So to pass a bill that says we're going to repeal the current law with nothing to take its place will cause pure chaos, not just for the individuals, but really for the marketplace. Insurance companies will not continue to participate in a market where there's no certainty that they will have any customers.
Well, Secretary, the insurers aren't participating in Obamacare as it's written now. On the healthcare.gov.
Well, that's not true.
Well, I've got
not true.
I've got the statistics. One of the huge issues that hit Americans is the fact that insurers have pulled out of a lot of these markets. And on the healthcare.gov exchange alone, 1 out of 5 consumers have access to only one insurer. Only one. And then in many instances, the competition is essentially a form of Medicaid. So that's the response to that. And by the way, in terms of the repeal and replace that the Republicans have talked about, there's a 2 to 3 year sunset that you would not have a repeal immediately of any of these elements. They're talking about a sunset or essentially an off-ramp in the repeal process.
But in a couple of months, Dagan, you would have to have insurance companies sign up to participate in the state-run insurance plans across this country within a couple of months. So if indeed the Congress moves ahead, the Republicans in Congress, and repeals a law with no certainty about a replacement, and there is no replacement plan, I don't care if they say, we promise we will have a plan within the next 2 or 3 years, no insurance company will participate. You are correct that in some markets there is a lack of competition. I would just suggest to you that there's far more competition in this individual marketplace now than there was 7 years ago before the Affordable Care Act was signed into law by the President. There are 20 million people who have coverage, some through Medicaid expansion, like in Vice President-elect Pence's state, which decided to expand Medicaid as the most low-cost insurance for the low-income workers.
But again,
and there are millions of people signed up in the marketplaces, and the demand is very high. Enrollment this year is running ahead of last year. So the notion that people can't find coverage or that it's not affordable is just not accurate.
But look, people have watched premiums skyrocket. 25% average premium increase just for 2017 in many areas. Donald Trump mentioned Arizona. You're talking about a triple-digit or a doubling of the premium cost. You have people who are losing their health insurance provider in many states. A woman who was in her 3rd trimester had to change her health insurance provider in the state of North Carolina. But I want to get down into the 19 million people who were previously uninsured who have gotten insurance. The majority of them have gotten it through the Medicaid expansion, and that is ultimately government health care. So would you rather see,
Well,
if you had your choice, would you rather
actually,
see...
that isn't accurate. Again, Dagan,
the majority of people have gotten it through
country,
Medicaid, have gotten their insurance through Medicaid.
Well, most of the Medicaid programs in this country are private insurance companies running a Medicaid program at the contract of the states. Again, I hear Republicans over and over again say, we'll turn Medicaid back to the states. Medicaid is run by the states. I'm a former governor. I ran the Medicaid program. The federal government contributes, but the state sets up the program. They contract with private insurers now in most states across the country to run the program. A lot of those same companies are also providing health insurance to small business plans and individuals, but Medicaid is run at the state level. It is the most effective insurance for the lowest income workers, and most of the Medicaid recipients, the vast majority, are workers in markets where they just do not have employer-based coverage.